When you think in terms of therapeutics, you think in terms of therapeutics for advanced disease and therapeutics for early and moderate disease. But also buried in that is targeting the virus itself versus targeting the aberrant inflammatory responses that often are the source and the cause of the morbidities and mortalities that we see with this particular disease. So first, if you look at the therapeutics for moderate advanced disease, one of the ones that have shown clearly to be very efficacious is dexamethasone in people who are hospitalized, who are on ventilators or have high flow oxygen requirements. It is shown to significantly diminish the 28-day mortality. There have been a group of studies such as baricitinib and remdesivir, which have received an emergency use authorization. Moving over to the left-hand part of the slide, there are a number of interventions that have been used for more early or moderate disease. For example, remdesivir, which is a direct antiviral, has received FDA approval, and a variety of monoclonal antibodies have also received emergency use authorization, as have convalescent plasma. Other antivirals, hyperimmune globulin, and things like anticoagulants are currently in clinical trial. One comment about things like monoclonal antibodies and convalescent plasma, since they are giving antibody to someone who would need a direct antiviral effect of the antibody, it is best to use it early before individuals actually have had the opportunity to progress. And that's what we're going to be seeing in the future, is an attempt to, as early as possible, get these interventions to the patients in their particular state, hopefully as outpatients, if we can logistically get that done. If we can move on to the next slide, and that is vaccines. As many of you know now, the federal government has been involved either in the development of and or the facilitation of the testing of a number of vaccines that represent 3 separate platforms. Shown on this slide is what we all know is the extraordinary, efficacious, and safe results of the Moderna and the Pfizer BioNTech product, with 94 to 95% efficacy and a good safety profile, both having received an EUA. What we're looking at closely now is others that you see on the slide, Janssen, AstraZeneca, and Novavax, which are in various states of trial. Of particular importance that you'll be hearing about likely within the next few days to a week are the results from the Janssen J&J trial. And the reason they're important, it relates to some of the things that Dr. Walensky said. And that is, it's a phase 3 trial with a different platform, a human adenovirus vector, but it is going to be looking at efficacy not only in the United States, but also in South Africa and in Brazil. So we will get a good feel from those, I hope, I believe we will. We'll let the data speak for itself. But what we will see was the relative efficacy against the wild type virus that is predominantly in the United States, as well as the South African isolate, which in fact is something that we will be able to get a feel for the efficacy there. So we'll have some comparative efficacy, which will inform us on where we would go if the eventuation occurs that we do have that particular lineage that would take seat itself in the United States. So let me move on to the last slide, because that relates to what I said. Dr. Walensky gave you a good feel for the distribution of the various lineages, the 117, which is in the UK, the 351 South Africa, which I just mentioned, and the P1 in Brazil. She mentioned about the increased transmissibility and the likelihood of an increase actually in some lethality in the B117. The important question that people ask is, what is the impact on both monoclonal antibodies and on the vaccine-induced antibodies related to the vaccines that we are currently distributing now? When you're looking at the 117, namely what we refer to as the UK variant, what we're seeing is a very slight, if at all, impact on vaccine-induced antibodies and very little impact on anything else. So we are covered with that. Things get a bit more problematic when you go to the 351, or what we're seeing as the dominant one in South Africa. Because in that regard, there is a moderate diminution, namely a multifold diminution in the in vitro neutralization by vaccine-induced antibodies. However, and this is an important however, it still is well within the cushion of protection. So you could diminish the vaccine-induced antibody efficacy by a few fold and still be well within the protective range of the vaccine. And that's the reason why you've seen announcements that actually the vaccines that we're using are still effective. However, given that as a fact now, we have to be concerned looking forward at what the further evolution of this might be. Now, I want to make one mention about the monoclonal antibodies because they are more seriously inhibited in the sense of impacting on their efficacy by this South African strain. That's the reason why there will be attempts to develop even other antibodies that might be able to avert this particular problem. So looking forward, what we plan to do in collaboration with the companies is to develop what we would call alternative or boosts that would use the same platform, but that would incorporate a particular immunogen that would address these particular variants. And for that reason, we will always want to be a step or two ahead of what might be a problem in the future. So I'll stop there now and hand it over to Andy Slavitt.
Thank you, Dr. Fauci, and also thank you, Dr. Walensky. That I follow in my report, Drs. Walensky, Fauci, and Nunez-Smith, very simply because it's important to send the message to the public that the White House respects and will follow the science, and the scientists will speak independently, and that our core values of science, public health, and equity are going to drive our actions here at the White House. The president launched a national strategy just as he assumed office on the second day. And at the heart of that plan is the most aggressive actions possible to stem the pandemic and follow the science. So Dr. Walensky spoke about the high levels of spread still in this country, even as they decline. Dr. Fauci talked about the threat from the new variants. And Dr. Nunez-Smith spoke about our difficulty and challenges in getting access to vaccines all across the country. So given those realities, accelerating the availability and the administration of vaccines are all the more important. So it's been a busy 7 days. You've seen us begin to execute our strategy. We've set up a team, began working with states and vaccine manufacturers, launched community vaccination centers, taken action to improve supply, revise travel restrictions, and more. Now, I know that many Americans are anxious and eager to get vaccinated. I want you to know we're taking this issue on with incredible urgency and purpose, despite not inheriting a fully developed strategy or the infrastructure to make vaccines readily available to Americans as quickly as they need to be. So far this week, we've been hitting our target of an average of 1 million vaccinations per day, necessary to meet the president's early commitment to administer 100 million shots in 100 days. Now, as you heard from the president this week, he is pushing us to view 1 million per day as the floor, not the ceiling. To that end, we are releasing more supply, activating FEMA, and deploying many more personnel. In fact, just this week, FEMA announced that they had obligated $1 billion to support state vaccination sites. Now I want to step back for a moment and put our vaccination plan in some context. To vaccinate every American over the age of 16, we are looking at a total need of well over 500 million doses of vaccines. Now, that assumes 2 shots for every American 16 and older. Now, I want to pause and say that everything we're talking about today, in terms of vaccines, reflects the vaccines currently on the market. That is a 2-dose regimen. We are not counting on things that are not in existence today. Our plan will be to make sure that we prepare for as many contingencies as exist. Right now, I want to level with the public that we are facing two constraining factors. The first is getting enough supply quickly enough. And the second is the ability to administer the vaccines quickly once they're produced and sent out to the sites. We are taking action to increase supply and increase capacity. But even so, it will be months before everyone who wants a vaccine will be able to get one. Now, let me start with what's happened so far. We've delivered 47 million doses to states and to long-term care facilities. We've administered about 24 million doses. Now, we've gotten several questions on this, so I want to be clear. As you heard us announce yesterday, any stockpile that may have existed previously no longer exists. Our practice is to maintain a rolling inventory of 2 to 3 days of supply that we can use to supplement any shortfalls in production and to ensure that we are making deliveries as committed. But we are passing doses directly along to states very much in real time as they order them. And we are confident that we will receive the supply on a rolling basis from the manufacturers to allow us to continue to do so. Now, we know there are places in the country with not enough vaccines. And at the same time, there are places with vaccines that they're not using yet. This is a natural challenge states are facing, and we will give them more visibility into their forthcoming supply and providing technical assistance that will help them make sure to make quicker use of these doses. But I want to emphasize an essential ingredient to increasing the administration of vaccines is passage of the American Rescue Plan, which dedicates needed money for vaccinators and for the administration of vaccines. Now let me take you through what we're doing to increase the supply. So the president invoked the Defense Production Act last week as a big first step to increase the supply of vaccines. We're going to make sure that we get 6 doses out of Pfizer's vials everywhere in America, because that's the potential. And we're going to do that by acquiring something called low dead space syringes. I'm sure everybody knows what low dead space syringes are. I now do. And yesterday, we announced a 16% increase in supply flowing to states every week for the next 3 weeks to a minimum of 10 million doses per week. That's good news. But what's also important about it is it gives states the visibility that they have lacked to know how many vaccines are coming in so they can make commitments to their partners in states and to the citizens and residents of their state so they know when to expect vaccines to arrive. Pfizer and Moderna are committed to delivering a total of 200 million doses by the end of March, with much of it coming at the end of the quarter. So it will accelerate. Pfizer yesterday announced that they think they can deliver 120 million doses this quarter. And as you heard from the president yesterday, the United States plans to purchase an additional 200 million doses from Moderna and Pfizer this year, which will be sufficient to vaccinate every American over the age of 16. And we expect those doses this summer. This entire thing is an unprecedented undertaking. We will run into unanticipated issues. But our plan and the actions we're taking in the days and weeks ahead is to deliver on these commitments to the public. Finally, we've also announced that we are creating additional paths to get Americans vaccinated. These will include standing up what we call community vaccination centers. We are going to launch 100 community vaccination centers this month. We will be also supplying vaccines directly to pharmacies. We will be standing up mobile clinics to reach hard to reach areas, particularly for pursuit of the health equity goals that Dr. Nunez-Smith has outlined. And we're going to partner community health centers that reach hard-hit communities and have infrastructure to deliver vaccines. But again, I want to close with this. It's critically important that Congress act. The American Rescue Plan is an important and vital part of getting America vaccinated. It's got bold and ambitious legislation that will help fund the effort that we're outlining today and providing the resources we need to defeat this pandemic. So we need immediate action.